Welcome, everyone. Excited to have you here for our webinar, Not in Your Head, Behavioral Health and Fibromyalgia. I'm honored to have you here to talk about behavioral treatments for fibro with our guest today. Dr. Dianne Shumay is joining us along with Sharon Waldrop, both of whom have extensive experience on this topic with their own clients. So really looking forward to a lively discussion today. I'm Nicole from Swing Care. And just wanted to share a little bit more about our guest before we get into it. So Sharon Waldrop is a national board certified health and wellness coach with over 27 years of expertise working with patients, physicians, researchers, and policymakers to improve the lives of people living with fibromyalgia. She is president and founder of the Fibromyalgia Association, a 501c3 nonprofit that she began in 1997 and that still meets monthly. In addition to her private coaching practice, she was vice president of education for the National Fibromyalgia and Chronic Pain Association and was a Cochrane Musculoskeletal Group expert peer reviewer for fibromyalgia. So thanks, Sharon, for being here. Really excited to have you.
Thank
And
you.
Dr. Dianne Shumay is a clinical psychologist with over 20 years of experience supporting patients with pain and chronic illness, including fibromyalgia. She uses approaches taken from cognitive behavioral therapy, acceptance and commitment therapy, and mindfulness. Dr. Shumay has specialty training as a clinical health and pain psychologist and is part of the Swing Care provider team. So thanks, Dianne, for joining again. And before we kind of get into the meat of the discussion today, I just wanted to kind of get a little bit of definitions going. We're talking about behavioral health today. Just wanted to learn a little bit more about what does that mean? How is that different from mental health? And then we can kind of go from there.
Well, I could start. There's a lot of terms out there and they've been used in different ways and they've been overlapping. And, there's been, a lot of, history of these different approaches provided by different providers and so on. So I think it's really helpful to think of behavioral health as really addressing those behaviors that we may be able to harness to help us either in our mental health outcomes, our emotional health outcomes, our social outcomes, and increasingly in our pain and other kind of chronic illness outcomes. And so really behavioral health to me is really an opportunity to think about harnessing our own behaviors, our own kind of mindsets and ways of looking at things, as well as how we use ourselves and how we interact in the world as really powerful behavioral medicine, really, that help us with our well-being and improve our lives and our health. I want to say something too about mental health, and that is that, I've been a health psychologist my whole career, and really where I work is in that intersection between people having, really very difficult physical health issues, medical issues like fibromyalgia, and how much that impacts someone's mental health. So we know that when somebody is dealing with something that's so life-limiting for many of our patients, that is going to impact quite a bit how they're doing, in terms of depression, anxiety. There's a lot of grief. There's a lot of social challenges. And so I just want to really shout out to the fact that there are mental health consequences of fibro, as well as, perhaps, many of the symptoms of fibromyalgia are also, can also be categorized as things like depression and anxiety. And so what we want to do as providers is really address the whole person. And I think it's really important to look at someone not just as a disease, but as a person living in a family, living in a community, working, wanting to thrive in their lives. And so I think it's really important to look at both mental health, emotional health, as well as physical health for our patients with fibromyalgia.
Yeah, and it is such a circular thing as far as certainly, in a chicken and egg sort of situation where sometimes we don't really know what did come first, is it the trauma in some cases, because trauma is very common in people with fibromyalgia. There are studies that show in as many as like 58% of people in certain studies had trauma as part of the fibromyalgia. So, and it all feeds off of one another. So it's so important to do that whole body treatment and to not look at the body and the mind and even the soul and our environment in silos. That they're all interrelated.
No, very well said. I think also of like just the experience of having fibromyalgia can be to some extent traumatizing. We certainly hear from our patients, for those people who've had difficulty with the medical system and been kind of bounced around from doctor to doctor, maybe not listened to, maybe not believed, that it can be really hard to manage just that kind of experience. And so we really want to support patients who've had that type of trauma.
Yeah, thank you for bringing that up. That is something that I hear time and time again, and sadly, isn't getting a whole lot better. When I started my association just 1 year after being diagnosed 27 years ago, back then it seemed like a little more understandable because the diagnostic criteria for fibro only came out in 1990. And I was diagnosed in 96. So it was still kind of newer, but it's sad to me that 27 years later, we're still dealing with that because we now know, fibromyalgia is real. As I mentioned, the diagnostic criteria was established in 1990, and Social Security Administration recognizes it as a form of disability, on and on as far as how legitimate and real the illness is. So, but that level of being told nothing is wrong over and over again, spouses hearing that and thinking that, oh, maybe nothing is wrong, is creating problems in homes. It's a serious issue. And so I'm glad we're here today talking about ways to address all of those issues.
When you're already tired, I mean, tired is like not even a good word for it, right? It's such profound fatigue for so many people. And then to have on top of it that need to advocate in an environment, self-advocate in an environment where you're not being believed or listened to becomes so huge and burdensome. So we really do a lot of support in our behavioral approaches for people's kind of building that resilience and those communication and self-advocacy skills. But we also I want to echo what you're saying, Sharon, that that there is such mounting evidence now in the field of fibromyalgia for really evidence-based approaches for care, that they're really it's really sad that people don't have access to it across the country.
We know in medical school, there sometimes isn't even a course on chronic pain management. Veterinarians actually get more training on chronic pain than our doctors do. So it's definitely a problem that needs to go back to the roots of the medical schools. And, hopefully different organizations are out there working. My Fibromyalgia Association has been one of them to advocate for more training and education.
Yeah, and training and education is a big part of also some of the things that we want to do, just not only patient education, but also provider education, right? Because that's really where it can start. And I'm so glad we kind of kicked things off with this, discussion, because we know that, depression and anxiety does coexist with fibromyalgia, but also that some of the medical gaslighting that fibro patients experience kind of derive from that correlation where, they hear from providers who think of fibro as kind of a mental health condition. And so being able to kind of talk about kind of the physiology is something that I wanted to address a little bit before we move forward. And Dianne, I'm wondering kind of from a neuroscience perspective, part of the evolving understanding of fibromyalgia is that it has that physiological basis in the central nervous system, and it's not all in your head as so many people kind of once told us or believed. And so just wondering if you can talk a little bit about that process and then also why a behavioral approach helps with this. And you already kind of mentioned that a little bit.
Oh, it's fascinating, and again, a lot of this evidence is building, and relatively recent and really good, robust evidence, really talking about how the brain. So we say, fibro is not all in your head, but to a large extent, it's in our brains. It's being because that is the location where pain is processed, interpreted, where sensations, where inputs are then kind of categorized by the brain, and so this increasing information that we're getting from the scientific studies is that this central sensitization syndrome is kind of a way in which our pain processing systems are interpreting those sensations. And sometimes we'll see, people with fibromyalgia explaining that their feet feel like they're on fire, or even the slightest brush past someone in a store feels painful. It's that kind of exaggerated, I guess, a pain processing or response that is very characteristic of our people with fibromyalgia. And so many people have looked into, okay, how can we shift the way the brain is processing these pain signals? Like, is there a way that we can kind of recalibrate or retrain the brain? And there are a number of behavioral approaches that seem to do that. And we have some great studies that even look at brain imaging and some other ways of looking at the brain to see if we shift how somebody reacts when they're in a situation with that kind of stimuli, um, react both cognitively as well as behaviorally. Can we, over time, almost build up a certain amount of resilience to that? And it's really a retraining process that has been extremely successful for people, really dramatically successful. How do you get access to that? That's a different question, because these are really cutting edge, state of the art approaches. But that science is really there to show that we can do some pretty effective things to help retrain that system.
Yeah, it is really exciting. I know that, being a fibromyalgia patient myself, I've done most of all those things on my own over time before the research was really there. It was just these behavioral modifications I learned on my own that were helping me. And in that moment, I didn't even know I was doing it. I wasn't necessarily connecting the dots on it. But when this new information came out on, neuroplasticity and the brain being very moldable and how our brain changes over time with chronic pain, but the good news being that it can also change back. And I'm not suggesting that you could go back to being 100% healthy, because we're not there yet. I wish we, had a cure, and we're not there, but we do know that we can really make huge improvements in the amount of chronic pain and the other symptoms that we feel with fibromyalgia by doing these different modalities that Dr. Dianne is talking about. And that's what I do as a health coach, is help people learn some of the ways to retrain our brain so that the central nervous system isn't so wired to create as much pain and symptoms in our body as it does without that education, without that knowledge. And it takes time. It takes time and patience. It's not a quick fix. It's not a pill that you can take and feel better right away, but it's really worth learning and practicing these skills and behaviors, because you can really get back to a life you love.
You talked about these are things that you kind of learned over, many years, decades, and now you're sharing with your clients. And so often we're talking with patients who have kind of learned to be kind of the expert in their own condition over many years, decades. And one of the things that's so helpful to have, a coach like you or another clinician is to really have a partner in that process and kind of accelerate that. So I'm wondering for both of you, and maybe Sharon, we can start with you. How do you start that conversation with a new client? And how do you even have the conversation about where to begin?
Yeah, that's a good point. And for every client, it's honestly a little bit different because the thing that brings me joy working with clients one-on-one is learning what they want to get back to, because sadly, most people are seeing me because there are things they can no longer do, things that they've cut out of their life. And those are the things that bring them the most joy and the most happiness, and the most vitality. And while some of that can be really challenging to do, sadly, we're not always able, at least, for a while, to do the things we'd love to get back to doing. But finding other things, by that I'm saying, um, for more than a decade, I couldn't ride a bike. I loved riding a bike, was not able to do it. But over time, and then also I learned about different bikes that were out there that were slightly different with the way they were actually designed that made it easier for me to ride a bike. Different things like that. So for me, it's starting with what a client is looking to achieve in life, and then helping them to understand the behavioral modifications that would enable them to get to that goal. Often learning what's really important to the client um, will be a good starting point for how I can bring that into the discussion. And I know, Nicole, you and I had a conversation around it being very difficult for people to sometimes get the mental health help that I can't provide as a health coach, but that Dr. Dianne can provide, and other pain psychologists that are out there. Um, and that can be a tricky conversation because, again, what we just talked about a little earlier, the fact that this person may have been told it's all in their head. So then when you explain that, no, seeing a psychologist has nothing to do with that, your fibromyalgia is very real, but there's some skills, there's some discussion that you can learn from a pain psychologist that will really improve your mental health help, which does, as we're saying today, it's all connected, does create that impact. So one of my jobs as a health coach is refer out to other healthcare providers as needed. And so if I identify that someone could, benefit from mental health help, that's always a part of my process with them, and working to get them comfortable with the idea. A lot of what I do as a health coach is educate around, just various, you name it, everything fibromyalgia A to Z, to get people, to kind of fast track that information so that they don't have to do all that learning on their own. And hopefully we can shorten the healing time.
Wow, that's really fantastic, Sharon. I know that your clients are in really good hands from what you just said. I think that what we call it psychoeducation or health education. I think that's one of the first steps that we all do when we get a new client. There's also kind of a something that you were sharing, which is um, looking at what somebody's intrinsic motivations are. So you really want to kind of start with a personalized approach, just like you're doing, and, kind of understand where the gap is between what they're experiencing and what they would like to have in their life. Um, and, sometimes well, we know that when we experience aversive experiences, and pain is probably the definition of an aversive experience. It's an experience that you don't want to have. And when you have it, you don't want to have more of it. You want to try to do anything you can to not have it. And so when you're living with that sort of situation, and many of the other symptoms of fibromyalgia are also aversive, is that you try to avoid those experiences. And what ends up happening is people's lives get really, really small. And that because you're pulling back, okay, that might cause pain. Okay, that might make me fatigued. Oh, I'm going to be embarrassed because I'm going to be the only one that's not able to, continue through that whole day in the group situation. So I'm just going to back off and say no to that invitation. I'm going to say no to this other invitation. And so that world just starts to just shrink down really small. And it's really a lot of what we're doing is gauging that willingness to expand their life, to move back, push back against what they're worried about is going to be the consequence of expanding life. So a lot of that first, really the first intervention that we do, we do this in acceptance and commitment therapy, we do this in CBT, beyond really kind of developing this great rapport with the patient, making sure that they know that we are compassionately on their side. And we do that by really listening deeply to what their needs are, right? And what their desires are. But the next, intervention that we're doing is we're really garnering that willingness. So we're really like figuring out a way to be together in this effort to try something new. It's really the willingness piece that I think has a lot to do with health, no matter what your condition. It's that just openness, that saying yes to something different, taking a little bit of a risk, and just a tiny little step sometimes into that opening, right? And that's what ends up happening when you start with just a little openness, is that willingness will then snowball, and you'll see people just saying yes to a lot of different things, and they're pushing back. What they're doing is they're saying fibro is not ruling me. I'm going to begin to rule my life. And how can I do that? And again, we just dip toe in the pool just a little bit. We're not throwing people in. We're just working together to just try to get that life opener, is that a word? More open, um, and more satisfying. And that, again, that sort of snowballs. And what's really cool about that is that's exactly what we want to do to retrain the brain. We want to get a little bit more. We want to push back against the instinct to pull in. We want to just push back against that really gently. And the more we do that, the more the brain kind of relaxes and says, this is an emergency. This is not, the house is not on fire. Like we can do a little bit more. Oh, I got a little flare up from that. Um, let me gauge, would I like to do less next time, or was it worth it to sort of expand my life, even with the little bit of a consequence? And, and we want to work with the patient around that, because we're not going to tell them you know, we're not going to tell them what they're willing to do. It's really how do you help somebody um, like access that willingness? And I like that word willingness better than this word acceptance, which it's sometimes synonymous with. Because for a lot of our patients, the word acceptance means surrender.
Yeah.
And acceptance and surrender would mean that they stay on the couch. Like that feels like so passive, like just, okay, my life is a couch. That's my life. Um, whereas willingness is like, I understand that I'm going to need to do this slowly. I understand that there's going to be some good days and bad days, and I'm going to be moving, but the willingness is that I'm going to keep kind of pushing back to expand my life.
I love that word willingness. It's beautiful. It is really helpful. And I think, exactly what you talked about, um the willingness to try, and making, I'm sure when you're working with your patients, giving them that safe space to really think about what it means to try, to think about what the obstacles are, the things that have maybe prevented them from trying up until seeing you, and working through those things together. And also that piece of what we talk about in my group is that payback. You do an activity that you love, or maybe you don't even love, and that payback piece, you know, that you're going to have to pay for it, but developing that plan then for how do you make yourself feel better if you can after doing something that you either wanted to do or you needed to do, so that hopefully that payback time is shorter and more manageable.
Mm. Very nice.
Is there an example of an exercise or an activity that you work on with your clients, and maybe they did have some payback time, or maybe they're trying to expand their willingness. Is there something that you recommend people try? Maybe people on this webinar today that they can kind of walk through to get a taste of what that's like.
I sometimes with my clients really work on loving kindness meditation. It's a practice I think so often, with or without fibromyalgia, we as humans are our own worst enemy. We're always so hard on ourselves. And I sometimes wonder if people with fibromyalgia have that, maybe even more so than other people, because they're just so hard on themselves about not being able to do things. And I find that when people, including myself, I've learned this for myself, that when you're really hard on yourself and you keep having all these negative emotions towards yourself, it's not helpful for your pain and stress levels. And we kick our body into that fight or flight even by doing that for prolonged periods of time. So I love teaching people about self-compassion, and there's a great website, self-compassion.org, Kristen Neff's website. There's guided meditations on there. For loving kindness meditation, I love to walk people through a little bit of an exercise, in that with my fibro brain, sometimes I need my notes so that I can remember to say things as I'd like to say them. So it's may I be kind to myself. May I be healthy. May I be healthy and happy. May I live at ease, and may I be safe. And visualizing, often for people, I even found it kind of hokey. I'll be perfectly honest. I found this stuff hokey when I first learned about it years ago. It took me time to come around. So sometimes people don't really like to use those phrases for themselves, but they enjoy kind of sending those messages out to a loved one, maybe even a pet. A lot of us have these pets that just light up our life. So if it's easier to think about doing that with, your spouse or a child, a friend that's really close to you, start with that person and practice saying those things as sort of a way to wish those things to that person in your life. And then you can practice and adding your own name to it. And over time, it's really funny. Over time, you may not know it in the moment, but as you keep doing it more and more, I feel like it sinks in, and it's a way to help people to not be so hard on themselves.
That's really lovely. I've used that many times with patients, and we've talked a lot about the need for self-compassion. Um, we internalize very young, really, those critical statements that that we say to ourselves, and then of course people hear it from outside as well, especially when they feel that they're not measuring up to, doing the dishes or working as hard as other people seem to be working, and that sort of thing. It can be really hard on ourselves. That's really lovely. There's an exercise that I sometimes do, kind of around willingness, that might be something that viewers can try right now. Um, and I think it also illustrates kind of physically how our mental state might impact our physical state. So I think it's kind of a nice illustration. So basically, it's kind of a postural thing. And so what I do is I say, okay, so if willingness is a state of receptivity, if willingness is a state of, oh, maybe possibility, like, then I would think of willingness as a posture of open palms. So you can kind of try this at home where you kind of relax your shoulders and your jaw, but you just open your palms facing up. And you just kind of notice the sensations, any sensations that you have. And of course, if you're in pain when you do that, you can do it with your hands in your lap. Like you can, just modify it in any way that you need to. So if this is the posture of willingness, and I think of this as willingness as receptivity, um, uh, what would the opposite be? Like, what's the opposite of willingness? So you think about like, what word is the opposite? Well, rigid, negative, I don't know, like no would be the word, it would be the opposite. And so think of a posture that would be correlated with that. And I think of like a clenched fist. So if you turn your arms over and you do a clenched fist in this direction, and you say, okay, that's the opposite of willingness. That's like a rigidity posture. Now, what I'd like you to notice is just what's happening in your face and your neck and your shoulders. And again, if this is too much for you, you can try to do it in your lap or just stop doing it. But you kind of notice anything you notice there. And now what I'd like you to do is let's shift back into willingness for a minute. So we shift back into willingness. And just kind of notice your jaw and your neck and your shoulders and your upper back. Just notice like, notice your heart in this state, right? And then we can go back again to the rigidity. And you can kind of notice all those things now. And you can pop back and forth into those two different states, and kind of notice that. I would be curious to hear, Sharon, if you noticed anything when you did those two opposite.
I did. I really did. So thank you for that. I was just telling Nicole before the webinar that I think I might be coming down with something. I'm having kind of a rough day. And so just that, just doing the open hands, I noticed, oh, wow, like I felt more relaxed. In the minute we went back to the fist, like I felt my whole body and my jaw and my neck and everything just tensing up. And I'm like, oh no, I want to go back to the open hand. So yeah, that was really helpful. And I definitely noticed a difference in the relaxation and not relaxation state of doing that.
And just one more thing about that is that when we are in a kind of a rigid mindset, and we potentially could measure those muscle tension areas, we might see more activation and tension in those muscles. I mean, that research is more than 100 years old, where we can see like manifestations of kind of our mindset in our musculature. I mean, that's not that's not new. That's like known things. And so if you go into that kind of more relaxed kind of willingness, how you would see something different when we measured your muscle tension. So it's not just postural, but it's a little bit of mindset, and it's that back and forth feedback that the body and the brain kind of give each other. That's really a healing state. So.
Yeah, and I explain a little bit of that to clients in my support group about just picture your brain sort of like the your computer, the hard drive on your computer. And if you have all these programs running, like it just everything slows down, things sometimes stop working right. And I feel like when our body has that pain and we have pain and more symptoms, it's just that much harder to do anything. That's why I think, the fibro fog, as we call it, with people with fibromyalgia kicks in and so on, can get worse. Certainly we can, just have it as a hallmark symptom of fibromyalgia. But but doing things like your exercise that you showed us, like it frees up the space in your brain to be a little more open.
I'd love to use that as a way to talk a little bit about, yeah, that connection between all of those different parts of our system that's kind of been the theme of this webinar. And, at Swing Care, we look a lot at patient outcomes across a variety of different endpoints. And Dr. Shumay, I'd love to hear a little bit about some of the outcomes that you see within our practice here at Swing Care. And, they go beyond, depression, anxiety, kind of some of those kind of classical mental health endpoints, and kind of speak to all those connections that we're talking about.
Well, we've certainly studied and kept data on a lot of outcomes at Swing Care, both in our clinical trials around the Stanza intervention, but also in the Swing Care clinic. And so we are watching kind of patient outcomes. What's really interesting to me as a scientist, as a behavioral scientist, is that these outcomes seem to hang together. And sometimes you might get an improvement on pain, but not an improvement on fatigue, or an improvement on pain and fatigue and depression, but not an improvement on sleep. But what we're seeing across these outcomes is that we're seeing improvements across all of these different factors. And, we're seeing improvements, and it makes sense, theoretically, because these things are all part of the same syndrome. And again, when we think about people as holistic, beings, that all of these things would hang together. But when you see it empirically, that's always really good confirmation that the approach that we're taking, which is an approach that addresses these behavioral aspects, these pharmaceutical approaches, et cetera, that you would end up getting kind of these outcomes that would hang together. So improvements across measures of sleep, improvements across fatigue, fibrofog, depression, and pain, and different measures of pain. So pain severity, but also the interference in your life that pain causes. So we see these beneficial aspects. And what we're not measuring really formally are some of these other really important things around social functioning, occupational functioning, life satisfaction, and so on. But we see that definitely clinically as improvements for people.
Yeah, and I think that speaks to that training of the brain, right? To be able to harness that and bring all of those things together in a way that improves overall quality of life, and what people want to get back to that they lost, like you pointed out, Sharon. So many people have stories of something that they lost and they want to get back to, and that's really our goal at Swing, and also with your clients, I'm sure. So, well, I know we have to wrap up because we're getting to our time, but I did just want to end with this question of access that you brought up at the beginning, Dianne. And how can people who are interested in looking more into these behavioral approaches find a setting or a provider to access these approaches? Often that's been really challenging, either from a financial standpoint or just a geography standpoint, trying to reach someone like you, Sharon, without having to travel hundreds of miles, someone who really understands fibro as well as all of your health expertise. So we'd love to learn a little bit more about that, as well as where people can find you, because that's also very helpful.
So I can be found at H as in health, W as in wellness, C as in coach, hwcsharon.com. And health coaches do not need to be certified in every state. So the cool news is I can work with anyone in any state, and even other countries if the time zone works out and everything. So that's how you can access me. You can also find other health coaches at the National Board Certified Health and Wellness Coaching website, and look for others if you were interested in seeing if there's some closer to you. And then I'm sure Dr. Dianne will share, but yeah, Psychology Today is a great resource for finding folks in your area. There's wonderful filters on there where you can get very specific and include things like chronic pain as well as your insurance in the search. And then of course, Swing Care. And I just want to congratulate you all on the work you're doing. And I was ecstatic to learn about your organization and the work that you're doing, bringing fibromyalgia expertise, medical care into, all of eventually all of the states, whatever your plans are. But, I'm excited to see it here in Michigan and other states where I know I've had clients access your program. So thank you.
I would just add on to that, Sharon. I'm so glad that you exist and you're available, and health coaches are getting, becoming more and more common and available. So that's really been a very big boost. Pain psychologists are limited in number, and oftentimes we can be found at sort of bigger academic medical centers. There's a fair amount of us at the VAs. So if you have VA insurance, you should be able to find a health psychologist or pain psychologist through the VA system, which is fantastic. One thing that I have advocated since day one is for patients to ask in your pain management clinic for them to hire a pain psychologist. So evidence would suggest that a pain psychologist is going to be a very important member of the multidisciplinary team. And so if your clinic doesn't have one, either they should hire one or get an affiliation or referral network going to support you in accessing the pain psychology modality. And now that we have more and more health coaches advocating for a way of sustainably hiring and maintaining health coaches within your clinics and medical setting would be really helpful too.
Can I also just add, I forgot to mention that my nonprofit, which can be found at managefibro.org. Again, that's managefibro.org. We have a monthly support and education group. So that social aspect, that community aspect that we touched on a little bit today can be something that you can access monthly from anywhere as another means of support.
Yes, that community support should not go undervalued. And if you're watching this in our Facebook community, I hope you're getting some of that there, but in-person support or that kind of live discussion, especially with a facilitator like Sharon or Dianne, can be so helpful. So shout out to that. And also, like Dr. Shumay mentioned, share this link with your provider or a pain management specialist, and maybe they'll learn something. And then you don't have to be the one to tell them. You can just, they can hear it from Dianne. But really appreciate everyone being here today. I'm Nicole from Swing Care, and Swing Care, as Sharon mentioned, and Dianne, is a virtual specialty clinic for fibromyalgia treatment. So please check us out if you're watching this, or look at other resources that we put together to help out. And looking forward to seeing you all on the next one. So thank you again, Sharon. Thank you, Dr. Shumay, for being here.
Thank you.